Today, we're going to talk about a medication that many of you might have heard of or even been prescribed: prednisolone. It's a powerful tool in a doctor's arsenal, but it's also a medication that comes with a lot of questions. What is it? How does it work? And what do you need to know if you're taking it? We'll break it all down in this video, but first, a quick and very important reminder. This video is for informational purposes only. It is not a substitute for professional medical advice. Always consult your doctor or pharmacist for any health concerns or before making any decisions about your treatment. So, let's start with the basics. What exactly is prednisolone? Prednisolone is a type of medication known as a corticosteroid, or more simply, a steroid. Now, when people hear the word steroid, they might think of the anabolic steroids used for muscle building. That's a common misconception. Prednisolone is a different class entirely. It's a synthetic version of a hormone naturally produced by our adrenal glands called cortisol. Cortisol has many jobs in the body, but one of its most important functions is to control inflammation. And that's the key to how prednisolone works. It's a potent anti-inflammatory. When your body experiences injury or illness, your immune system kicks into gear, causing inflammation. This is a normal and healthy response. It's your body's way of fighting off invaders and starting the healing process. Think about a mosquito bite. It gets red, swollen, and itchy. That's inflammation at work. However, sometimes the immune system goes into overdrive or mistakenly attacks the body's own tissues. This leads to chronic or excessive inflammation, which is the root cause of many diseases. This is where prednisolone steps in. It works by suppressing the immune system's response, thereby reducing inflammation and its symptoms, like swelling, redness, and pain. Because it tackles inflammation at its source, prednisolone is used to treat a wide variety of conditions. It's prescribed for allergic reactions like severe asthma attacks or skin rashes. It's a cornerstone of treatment for autoimmune diseases such as rheumatoid arthritis, lupus, and inflammatory bowel diseases like Crohn's and ulcerative colitis. It can also be used for certain skin conditions, eye problems, and even in some cancer treatment regimens to reduce side effects. Because it's such a powerful medication, how you take prednisolone is really important. It usually comes in tablet form, but it's also available as a liquid, eye drops, or an injection. Your doctor will determine the right dose for you, and this can vary wildly depending on your condition. Sometimes you might be on a high dose for a short period to get a flare-up under control. Other times you might be on a lower maintenance dose for a longer duration. One of the most crucial things to remember is to take it exactly as prescribed. Don't stop taking it suddenly, especially if you've been on it for more than a few weeks. Your body gets used to the external supply of the steroid and reduces its own natural production. Stopping abruptly can cause withdrawal symptoms like fatigue, body aches, and dizziness. Your doctor will guide you on how to taper or gradually reduce the dose to allow your body to readjust safely. It's also generally recommended to take prednisolone with or after food to help protect your stomach. Now, let us talk about something that's on everyone's mind when they start a new medication: side effects. Because prednisolone affects the entire body, it can have a range of potential side effects, especially with long-term use or at high doses. In the short term, you might experience things like an increased appetite, mood swings, feeling really high, or really low trouble sleeping, or indigestion. You might notice you feel a bit jittery or have more energy than usual. These are quite common. When taken for longer periods, the potential side effects can be more significant. These can include weight gain, particularly around the face and abdomen, which gives that classic moon face appearance. It can also lead to thinning of the skin, easy bruising, and muscle weakness. More serious long-term effects can include an increased risk of infections because it suppresses your immune system. It can also affect your blood sugar levels, potentially leading to or worsening diabetes. It can impact your bone density, increasing the risk of osteoporosis, and it can raise your blood pressure. It can also increase the risk of developing stomach ulcers or cataracts. Now, hearing this list can be scary, and that's completely understandable. But it's vital to put it into perspective. Your doctor prescribes prednisolone because the benefits of controlling your serious medical condition outweigh the potential risks. They are constantly weighing these factors. It's all about risk versus reward. For someone in the middle of a severe asthma attack who can't breathe, the immediate benefit of prednisolone is life-saving. For someone with debilitating rheumatoid arthritis, it can mean the difference between being bedridden and living a functional life. The key to managing these side effects is open communication with your healthcare team. They will monitor you closely with regular checkups, blood tests, and maybe even bone density scans. There are also steps you can take to mitigate some of these risks. For example, to combat the risk of osteoporosis, your doctor might recommend calcium and vitamin D supplements and encourage weight-bearing exercise. To manage blood sugar, you might need to be more mindful of your diet, cutting back on sugary foods and refined carbohydrates. Eating a healthy, balanced diet and staying active as much as your condition allows is always a good strategy. And let's not forget the mental and emotional side effects. Mood changes are real. You might feel irritable, anxious, or just not like yourself. It's so important to be aware of this and to let your friends, family, and your doctor know what's going on. Don't just suffer in silence. Sometimes, just knowing that the medication is the cause of these feelings can be a huge relief. And remember, if you ever feel overwhelmed or your mood is very low, please reach out for help. There are resources and people who can support you. So, to wrap things up, Prednisolone is a potent and effective anti-inflammatory medication that can be a game changer for many serious health conditions. It works by dampening the immune system to reduce harmful inflammation. While it does come with a significant list of potential side effects, especially with long-term use, your doctor has prescribed it, because the benefits are believed to outweigh the risks for your specific situation. The keys to using it safely are taking it exactly as prescribed, never stopping it suddenly without medical guidance, being aware of potential side effects, and maintaining open and honest communication with your doctor. Proactively managing your lifestyle with a healthy diet and exercise can also make a big difference. Thank you so much for watching. I hope this breakdown has helped demystify Prednisolone and empowered you to have more informed conversations with your healthcare provider. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more clear and reliable health information. And don't forget to hit that notification bell so you won't miss our next video. Stay healthy, stay informed, and we'll see you in the next one.